Thank you. Thank you very much. It's great to be here, and thank you for the introduction, Papi. My name is Bankole Cardoso, as Papi mentioned, and I'm a Nigerian tech entrepreneur. I want to talk about technological leapfrogging and how I feel it can impact development. I have two personal stories to share about technological leapfrogging. Leapfrogging is basically the idea that nations can adopt systems and technologies from other existing places and use it to fast-track their growth. So essentially what this does is it allows nations like developing nations the opportunities to skip the intermediate steps that developed nations have undergone and to learn from them and to capitalize on those lessons learned. I'm currently based in Nigeria, where I grew up, in Lagos, Nigeria, and I'm running a company called Easy Taxi. Easy Taxi is a smartphone application which uses GPS technology to connect drivers who are on our network to passengers trying to use our app. Before Easy Taxi, there was no real way to hail a taxi in Lagos. You had to go on the street, and you would wait probably 20 to 25 minutes looking for a taxi in 100 degrees weather or more. There was safety issues for many people around using taxis because of fears of kidnapping and other security issues. So people really did not trust taxis, and there was no taxi culture in Lagos. With Easy Taxi, what I realized is that we had the power, using technology, to leapfrog the whole development process that nations like here have undergone, and to revolutionize the taxi industry and the transportation network in Nigeria. So a technology that is very common here, that people are very familiar with, had the power to really affect the development of the transportation network in Nigeria. Now people are using Easy Taxi, and a lot of Nigerians are comfortable using taxis because it's safer for them. They feel that the taxis are reliable and convenient to use. We've cut the wait times from 25 minutes to about 5 to 10 minutes to get a taxi. What I've realized in running an innovative company in a developing country is that you have to be in control of the whole process, because oftentimes your customers don't trust your service because it's so brand new to them, and there's an education gap which you have to fill. So for us, being a marketplace where we're connecting drivers to passengers, we've tried to innovate in many different ways to keep people engaged with us. And one event I'm particularly proud of is last year, where for our anniversary, we teamed up with Monopoly, the board game. I'm sure everybody knows Monopoly board game. So there's a Lagos City edition of the game, and what we did is we set up teams of 3 people, but 10 teams, and we had them playing the board game in real life. So when they actually landed on a particular location, they had to request an Easy Taxi on their phone and go to the location. And then we spruced it up a bit more and made it like Amazing Race. So at each location, there was a challenge for them. So it was a very fun event, and we used only social media to promote the whole day. I believe that this is an example of how leapfrogging can be positively impactful in a developing country. On the other hand, I've also witnessed the negative aspects of leapfrogging technologies in the healthcare sector. My mother, who's on the screen, was the lead physician in a Nigerian hospital. This is the same hospital that I was born in, that a lot of my best friends were born in and went to, and my mother had worked in for 21 years. She was synonymous with the hospital, and she often was referred to by her colleagues as the first lady of the hospital, because many patients would come in there and demand just to see her. They didn't want to see any other doctor, even though they were ill. It's a bit strange. But that was an example of how efficient she was and how excellent she was as a doctor. She treated generations of families, great-grandparents, grandparents, parents, the children, and even grandchildren. And that was also the case in our family. On July 20th of last year, a Liberian diplomat arrived in Nigeria, in Lagos, Nigeria. Lagos, as you can see from the picture, is an incredibly overpopulated, densely populated place. There's about 20 million people. It could be 25, could be 30. There's no census done. So this man had collapsed on the plane and was rushed to a nearby hospital. This was a government hospital, and at the time, the public hospitals were on strike because there was a dispute between the health workers and the government. So instead, they took this man to a hospital about 30 minutes away. This is my mom's hospital where she worked. Upon arriving, the man complained that he was suffering from malaria. So he was admitted for malaria and being treated. The next morning, my mother arrived at the hospital, and upon arriving at the hospital, like she always does, she went on her ward round to visit all her patients on admission. This was the last patient she saw that day, and she immediately suspected that he was suffering from something more acute than malaria. And in her own words that evening when I saw her, she mentioned that it looked as if his blood was seeping out of his skin, and she looked very disturbed. She immediately suspected that this man may have Ebola once she heard that he was coming from Liberia. No other doctor had suspected that. And up until this point, Ebola had never been in Nigeria. There had not been a single case of Ebola in Nigeria. No Nigerian doctor had seen Ebola. And Nigeria was completely unprepared for Ebola. Our West African neighbors, Guinea, Liberia, Sierra Leone, had been battling with the disease for the best part of 9 months, but we were unprepared. There was no protocols, there was no quarantine centers, there was no isolation centers, there was no protective gear in the country. My mother informed the government that she suspected that she may have an Ebola patient, despite this fact being that she just had a suspicion at the time. The man grew furious, and he involved the Liberian government. He involved the ambassador to Nigeria in Liberia, and they threatened to sue my mother for not allowing this man to leave the hospital. The man had come into Nigeria to attend a high-profile African Union conference in another Nigerian city. So there were going to be many African leaders there. Yet, he complained that he was being kidnapped by my mother, for her keeping him in the hospital. Unfortunately, this man intentionally, according to stories I heard, intentionally spilled his bodily fluids in the hospital to infect healthcare workers. As I mentioned at the time, the government was unprepared and there was nothing they could do. So my mother, with the limited resources they had to keep the man in her hospital. Unfortunately, 2 days after my birthday, my mother lost the battle to the disease which she caught from this man. Nigerians all over have been very proud of the story of what she did, of how she prevented and contained an outbreak in Nigeria. If this man was allowed to leave the hospital, it's clear that hundreds or even thousands of people would have been infected very easily. And as I mentioned, many people were coming from other African nations that would have been in contact with him. During this period, my father and I were also under our own incubation period of 21 days. And in that period, I realized that the human body, the human mind can play incredible tricks on you. Despite the fact that my temperature was relatively stable in the 21-day period, I felt every single symptom of Ebola. We had no idea what was going to happen to us. Every morning we wake up, we'd immediately check our temperatures. How do you feel? All that stuff. So anytime I looked at the newspapers, my mother's face was on it. News, radio, TV, it was all about Ebola. My phone was ringing so much, and it was just all too much to bear. This, in one way, is how I feel that the Nigerian is a failure of the Nigerian healthcare system. And I think that it's partly because of technological leapfrogging. And this is true of many developing countries. Nigeria has medical hospitals, yet we have no simulation labs. We have, state-of-the-art medical facilities, yet we don't have enough healthcare workers to operate them. It's a really frustrating paradox of the Nigerian healthcare system. My family and I, despite this grieving period for us, this particularly difficult time, we decided to set up a healthcare trust in honor of my mother. The Healthcare Trusts is a non-profit organization set up in Nigeria to positively impact healthcare workers. We've done our research, and we believe that instead of focusing on technology and state-of-the-art medical facilities and gadgets, it's best that we focus on the core backbone of the system, which is the people. My mother valued training very highly. She always trained her workers at the hospital, her junior doctors. She made sure that they were up to date with medical practices and advancements. And so we believe that by doing this, we can continue her own legacy, but also make a positive impact on the Nigerian healthcare system. The Health Trust is an organization with a 7-member board of trustees and a 4-member board of advisors, international board advisors. We hope that with our fresh approach to the healthcare system, with our innovation, we believe that through simulation trainings, medical labs, and other educational tools and seminars for the Nigerian healthcare system and also the African healthcare system, we can positively impact the whole healthcare system in Africa. In the last few months, we've met with international organizations such as the World Bank, the UNICEF, and we've discussed with them their own experiences. We made sure we've learned from them what they feel is lacking in the healthcare system there, and we've discussed with them our own ideas and shared with them our business case. And we are confident that with our fresh approach to the healthcare system, we can make an impact. Simulation training is one way that we believe we can do this. Medical ethics is another way we believe we can do this. And we hope that by doing this and actually impacting the people in the healthcare system, that they will deliver better quality care and save more lives, just like my mother did. Thank you.